Good afternoon, everybody. Today is Friday, November 5th, 2021. My name's Scott McGann with the Falmouth Health Department, and we're doing a weekly COVID-19 update, probably for nearly the 100th time, but we'll keep doing these as long as there's a need to do it. Our email is health@falmouthma.gov. Our phone number is 508-495-7485, and our website is falmouthma.gov. So we had a good week this week. This week we had, our total case count is 2,065 with 14 cases this week. So we've had a good week, 5 probable cases. 99% or so are out of isolation. It's only going to be the ones that are more recent. Our daily, 14-day daily incidence rate per 100,000, again, to explain that is, to make towns look even in how their infection rates are, you assume a population of 100,000. So with Falmouth having about a third of that, you take the number 8.7 divided by 3, and then that gives you our daily cases, so a couple a day, 3 a day. So that's what that incidence rate is. That helps us compare, let's say, a small town like Wellfleet to a large city like Boston. You look at their incidence rates, and it's just adjusted to 100,000. So that's where it is. But anyway, we've dropped almost half because we've had a good couple of weeks. And our percent positivity's dropped to 1.61. And so that data is from the 17th to the 30th. And since the 30th, it's been about the same, a couple of 2 to 3 cases per day. I haven't seen anything increase right at this point in time. So that's a good week. We'll definitely take it. Looking at our case chart, you can see that with far right, the last 3 dots on the right show a drop in cases over the last 3 weeks, and we will definitely take that. This is our flattening the curve. We don't use that term much on TV anymore, but flatter and densely packed together these little dots are, the better time we're having. The more spread out and more rise we have, the worse we are, and you can see that we're sort of on a trend towards another flattening. If you look at Barnstable County, this is all the cases in Barnstable County since the beginning. On each line represents a 3-day. Looking at it, you can see, that we didn't get a spike or haven't gotten a spike since Delta's come in, which is right around where the cursor is pointing now in mid-July. You see more of an ebb and flow, but you don't see that spiking, and that's because we have such a good vaccination rate. And that's without guidance. I mean, this isn't April of 2020, so that's good. Another good sign that we have recently, both on 11-1 and 11-4, I got 2 reports about the hospitalizations and 0 in Falmouth. 8-3 and 9-2 from Cape Cod Hospital and 0 from Falmouth. So that's another good sign. Statewide, it's been in the 12 to 1,500 of daily cases. The positivity's actually ticked up a little bit over the week. It was at 1.6 something, but it's definitely been under 2 for quite a while now. So that's another sign solidly that it's being well managed with the vaccination rates that we have in the state. All our trends, you're not seeing an increase in the trends. You see more flattening to lower throughout the state. And looking at our incidence rates among our peers here in our other communities here on the Cape, all of Massachusetts, the same time period, which is between the 17th and the 30th of October, you see that 16.5 is the daily incidence rate in all of Massachusetts per 100,000. Falmouth's right now this week, these past 2 weeks have been roughly half of that. So that's a good sign. We've sort of in the lower half of the incidence rate on the Cape. Percent positivity, we're right around a little slightly below the state. We've got several communities over 3. Looks like Yarmouth had a tough period of time, Bourne as well, and Sandwich. So there's definitely an ebb and flow to this. We've had a couple weeks ago that we weren't doing so, we were a little on the high side, and then, the other communities weren't. So there's definitely an ebb and flow to it. And you can see that when we, going back up to that Barnstable County, sort of that up and down, sort of thing. This is all cases. I don't really show this one, but I figure it was worth it. This is all the cases in the county and how it's broke down by town. Falmouth being the second largest town on the Cape by far. The number is actually on the lower end. We're neck and neck with Yarmouth, which has 10,000 less people. we have a third less people born in Sandwich. So, I mean, we're not, we definitely we've had our fair share of cases, no doubt about it. But, we're less than half of Barnstable. And so I think we've held our own throughout the pandemic with our cases, because quite frankly, looking at population, if all things being equal, we should be somewhere, we would be somewhere higher. But we are tied for second. We would be the second because we're the second largest, but we're not, if Barnstable was the average, then we would be somewhere around 3,500 as opposed to 2,000. So we've definitely done a good job holding our own. Some of the Outer Cape towns, you see real low numbers. In 2020, there was a little bit difficulty getting PCR tests out there. They relied a little bit more on the probables, the rapid antigen. This is only PCR. But in large, we've held our own. Cases in fully vaccinated individuals, there's been 54,199 breakthrough cases, 1,793 hospitalizations. That number used to be around 3.75 to 3.8, so it's actually slightly lower, 3.31%. And I think this number is right about the same, maybe a tick higher. The deaths of 438, which is 0.81% of all cases of breakthrough. On the far right, you see that it's been slightly over 1% of all fully vaccinated individuals have gotten COVID. Hospitalizations among all vaccinated people is well under 1%, and deaths are well below 1% at 0.09%. So they up that every week. We remain, eligibility-wise, all eligible residents is 91% have gotten at least one dose in the county. As far as fully vaccinated in the county, it's 74%. But eligible people, it's 91, fully vaxxed, and 74% of all residents. This is our vaccination chart. I'm going to add, starting in a couple of weeks, a 5 to 11 category, which on the bottom right, where you see 92 and 82. So we have 92% of all eligible residents have had at least one dose. That's awesome. 82% of all eligible residents are fully vaccinated. Those numbers obviously will drop when we add a new category that's got 0% vaccination. So next week, I think I'll add the 5 to 11. This number will drop because it's going to add, 1,000, 1,500, actually probably add about 3,000 or so to the number, which will drop these out a lot. Well, and then that'll increase as time goes by, depending on how many 5 to 11s. We'll talk about that in a second. But 83% of total population vaccinated, 74% fully vaccinated, 83% first dose. But then the eligibility is going to increase to more people, so this number's at the bottom of the 92 and 82 will actually go down. 300 new doses, so 300 residents chose to get vaccinated in this time frame, and 106 got their second dose. And that's a huge jump from what we were seeing earlier, 406 doses for the 7-day period. I think that has a lot to do with employer requirements for vaccinations. I think that's got something to do with that, no doubt, or people changing their mind as well. But that's a pretty strong number. It's been mainly in the working grade age, so that 20 to 65. So that's also an indicator of the employer's requirements. Again, been easy to get a vaccine. I look like once a week on the Vax Finder, and I can find appointments at pharmacies every day. Barnstable County on Thursdays are doing it at their office. Convenient MD, I believe, had some. I don't know if they're still doing it. Community health centers also. And homebound, again, if you know someone's homebound, we have a program. We've always had the program. We did it originally. Also for booster doses, you can contact the health department, and we'll reach out to the VNA to get that done. So that would be both for first-time vaccinations, the series, or with either the single-dose J&J, and also for boosters. Testing, again, we're still doing the school-based test and stay. Convenient MD still does probably the most amount of testing, followed by CVS. You can get an appointment at Falmouth Hospital through your physician. Fairgrounds is no longer Sunday and Thursday, it's just Thursday. There's just not a lot of people going there. It is free, but the timing has to be right, obviously. You don't want to be waiting to get tested. So that's why the Fairgrounds, doesn't necessarily work as well, but Convenient MD and the rest do. And the Community Health Center can also do testing. Booster doses, this has not changed, but it's good to go over every week. Pfizer and Moderna, after your 6 months, after your 2-dose regime, if you're 65 and older, 18 who live in long-term care settings, 18 and over have underlying medical conditions, or 18 who live and work in high-risk settings. If you were originally vaccinated with J&J, you're eligible no matter who you are after 2 months. okay? And you are allowed to mix and match vaccines. That has not changed. High-risk work settings, first responders, educational staff, food, agricultural, manufacturing, corrections, postal service, public transport, grocery stores, restaurants, things of that nature are all high risk. They're free to get a booster. And again, you can just go right on VaxFinder, and if you wanted one this afternoon, every time I check, I can get one the same day. Vaccines were just approved for 5 to 11-year-olds. It's a third dose. Pediatricians have been contacted by the state and may already have them, so I don't know. They'll probably be reaching out or figuring out your pediatricians. They either have them or they're close. We're ready to go. We're just real soon you'll see school-based ones as well, at least in Falmouth Public Schools, because just got to work out the dates and things of that nature, so that will be available for those that are 5 to 11. A couple new things I was hearing in the news, so I looked them up. New COVID oral treatments are on the horizon. So this Paxlovid from Pfizer reduced the risk of hospitalization or death by either close contacts or cases by 89%. And I can't pronounce it, Molnupiravir, Piravir. Britain on Thursday became the first country in the world to approve a potentially game-changing COVID-19 antiviral pill jointly developed by the U.S.-based Merck and Ridgeback Biotherapeutics. So I just happened to look those up. I heard about the Paxlovid today in the news. If anybody who's into organic chemistry, I don't know why, I hated that class. You can look at the far right. It gives you the structure. But that being said, there's a couple that would be great. If you got a breakthrough case or an unvaccinated person, you would have the ability to take an oral treatment at home. That could be a game changer as well. So those are on the horizon. They're not approved yet, so I wouldn't be asking my doctor for it yet. But those are on the horizon, and you can research them. Just Google it, and I just did that this afternoon, right before I'm on here today. Face coverings, we still have the mask advisory. State still the same. CDC is, I'll talk about that in a second. Schools are still doing it. They've extended that requirement till January. So schools will still have the requirement for mask wearing. I'll talk a little bit about town meeting. I believe we'll do face coverings for town meeting as well. But in terms of everything else, there's still a mask advisory. Not picking and choosing certain things like senior center or groups here or groups there. I think I look at it, at least myself, as an all or nothing. So, I've had some inquiries about reestablishing a mask a mask mandate rather than the advisory, or in certain circumstances. I'm really not looking at certain circumstances. Obviously, the operators of those circumstances or those establishments can decide to do so. But I think as the health agent, I'm not going to pick and choose different places that it should be worn. That would leave that up to others. With me, it would be an all or nothing. And then I'll show you that slide again about where we have that line in the sand. There it is. So we're both in the low category for incidents right now. We dropped a full 7.1, which is 2.5 cases per day drop. And the 14-day positivity is way down. No one's in the hospital this past week. I forgot to update this at the bottom, so we go back to the other one. We're at 92 and 82% of. I meant to update this. So 92% of all eligible residents have had at least one dose, and 82 are fully vaccinated. That is really high numbers. So the line in the sand is substantial or high infection, which we are nowhere near at this point. So I would continue with the mask advisory. The Board of Health and I have discussed this months ago, and this is what we're using. And so that's where we are with that. In terms of flu clinics, again, if you want the high dose, we have a clinic Monday, November 8th. And so it's really, got to call us today. We tried to message it out. The senior center sent some messages out. If you want the high dose, you'll hear this afternoon. Even if you hear this late and you say, oh my goodness, if you call us real early on Monday, maybe we could work something out. But we bring the vaccines they're stored in Dennis with the VNA, so they'll be coming Monday morning with the doses. They're going to be bringing high dose and regular dose for that. That's for 60 and over. And our Monday, November 15th clinic, we have hardly any sign-ups for that from 3 to 6 at the Gus Canty. There won't be any high dose at this clinic, but you want regular dose, you just call us by the 10th, and we'll register you. So that one's still some time for that. That'll be just regular dose. That's sort of the regular clinic we do every year. The last year was a drive-through. This is a regular one where you walk in. And we'll give you instructions on what to do. Bring the form. We'll give you the form and get it offline. Get it online at our website. Insurance card, short sleeves, wear a mask. So, if you hear this late, this usually gets posted to YouTube and FCTV and the website later today. But really, by today, we need to know because the nurses will be leaving Dennis by 9 o'clock tomorrow, Monday morning. So anyway, if you do register, try to do it by this afternoon. We did re-message it out. We did have more people today request. So in terms of our recap, so our cases have dropped the last 3 weeks, which is great. New oral treatments pending, which is awesome. Vaccine eligibility is now 5 and over. Third dose and boosters are for all 3 vaccines and are readily available. And the 5 to 11 doses are arriving to PD offices. If not, they're already in schools, and they'll be scheduling it through the schools, so you'll be messaging it out that way if you have a child that goes to the schools. And again, flu shots. If you want the high dose or a regular dose, but you want to do it at the senior center. If you want regular dose, you can always go to the 15th, but the high dose one is going to be the 8th, which is Monday. So again, that's it for my update. If you have any direct questions, you can call or email us, and we'll talk to everybody next week. Thanks.